Supposedly, a car is gonna meet us here, a truck is gonna meet us here.
Yeah, it must be these dudes.
You think so?
But they're going so slow through here.
Is this them?
So they say, look, you could consider working even if you've been exposed as long as you have a mask. And by the way, we don't necessarily have enough masks. So within those guidelines as well, they say bandanas and scarves could potentially be considered to be used as well.
Use scarves and bandanas? I'm not gonna let my friends that are working on the front lines, nurses, doctors, CMAs that are treating patients to go and get scarves and hope that that somehow protects them from this virus. I'm gonna do what I can. What I can is getting these masks.
Yes, I'm gonna take to the streets in just a moment, but first, what masks am I talking about? I'm talking about N95 masks. Not these, not these, these. Why do I want these? Long story short, N95 masks protect medical workers by filtering out at least 95% of particulates in the air. They fit very close to the face and actually need to be fit tested by staff, as opposed to surgical masks, which hang loose and don't provide nearly the same protection. Okay, so hospitals are short on these special masks, but if they can't track them down, what hope do I have? Well, N95 masks aren't only for doctors. Construction workers and painters use them as well. When it became clear that the world was gonna need lots of N95 masks, people started scooping them up quickly, thereby inflating the price by a lot, like 700% a lot. And while hospitals don't have the ability to seek these masks out and negotiate, I do. Now this is very polarizing. Yes, people should not be rewarded for profiting off a crisis, but desperate times call for desperate measures, and I desperately wanted to protect my colleagues and I, which brings us to day one.
So told me you have 3M masks available?
3M masks, the regular ones, and then one for the H2.
What's the expiration date on the N95 3M masks? Alright, so they're good. And the cost of the N95 mask? And where are the masks? Bear, are you coming? Give me 5. High five for masks. High five for masks. Come on, high five.
As it happened, Bear knew something we didn't. This day was not gonna go as planned.
Check out this truck that's gonna deliver some masks. 20 feet of some horsepower that's gonna get us there safely and deliver these masks to keep our doctors and nurses healthy. Someone scratched it. Let's do it. Where are we getting the pickup from? Yeah. Where's the wipers? There we go. Oh, high quality wipers. All right, we've arrived where we're getting these masks from, and I'm not gonna lie, it feels really strange and shady. Supposedly, a car is gonna meet us here, a truck is gonna meet us here.
Yeah, it must be these dudes.
You think so?
But they're going so slow through here.
Is this them? I mean, this has to be them, no?
What else would this be?
They're wearing masks, and there's 3 of them, and they have their hazards on. We don't have a sign. What's the sign?
That's a quote from every drug movie and TV show. How do I know it's them? No. Don't know.
Will they just come out and start throwing masks? It looks like they're gonna make a right turn.
He said any minute you're gonna see a big, huge UPS truck. Like, you know, the cars with UPS trucks?
Okay.
They're pulling up. Okay, perfect. Pulls up, you already to the merchandise. Awesome, perfect. He just called the driver, and the driver said he's the next stop.
Awesome, perfect, thank you. All right, so it looks like we have this quote-unquote UPS truck that's about to deliver these masks. I don't know if it's it, but I hope it's it, because we've been waiting here for a few hours now, and I desperately want to get these masks to where they can be useful. Oh, it pulled over, that's not the thing. Damn it. Think this is the winner? I don't think so, because he's not slowing down. Damn it. All right, so it's like hour 3 waiting for these masks. I hope this is not a fictional mask situation, because I've already paid $15,000 deposit to get them, but we can't locate the truck driver.
It was, in fact, a fictional mask situation. Sort of. The truck never showed up, and another guy, partner of initial guy, showed up and informed us that guy number 1 screwed up the delivery date. As it happens, the shipment was due to arrive the following day at a different location. Anyway, they apologized profusely, and we made arrangements to meet on day 2.
I'm driving now to like a 4th location to get these masks, and we're not gonna get the full amount that we required, but at least we're getting some. Fingers crossed. I'm getting really frustrated already at this point. The goal is at least to get half the masks today, and then figure out what we're doing the rest of the week, but that will at least get us through a couple of weeks of testing.
2 hours later.
All right, we got the masks. Well, at least half the masks. And they look legit, they're 3M, so I'm bringing them to the warehouse right now. Michael, does getting this ease some of your strain with ordering?
Of course, everything we can get our hands on will help the situation, but people need to understand that these need to be reserved for the medical community. They are to prevent someone from catching the virus who's dealing with a critical patient. That's it.
Hopefully we can get the rest tomorrow. Hopefully we can
get the rest tomorrow.
Oh, how naive I was. I was playing right into the Hustler handbook. They gave me half the merchandise and a taste of success. I was feeling good. This thing was starting to turn around. But all of this was just priming me for the curveballs that were to come on day 3. I just saw some doctors performing tests on patients just wearing surgical masks. I saw nurses swabbing a patient's nose, a famous influencer, wearing a surgical mask. This is putting them at risk. We don't need to do that. First of all, not everybody needs to be tested, at least right now, because it's not that we're gonna run out of testing kits. The real issue is the safety of the providers, meaning the nurses and the doctors and the CMAs, but then also the environment. If they're walking into an office and they're sick, they can be contaminating everyone around them. So it's not so much the shortage of kits anymore, it's more about getting the personal protective equipment and figuring out the logistics of how to conduct these tests. Later today, we're gonna be showing you a drive-through testing site that's being done right, and they're gonna be using some of the personal protective equipment I'm buying. So I'm really excited to show that to you guys, but on the journey now. All right, we've arrived at the location to get the masks, and we're gonna take them directly to the healthcare providers that need them. We already got a few offices lined up, some drive-throughs, hospitals, all of that. Let's make it happen. As I walked into the warehouse, discrepancies in pricing arose, and I rushed to get guy number 1 and guy number 2 to talk it through. Just to confirm and replay back everything, initially you and I discussed, you told me the masks are $7.50 a piece. I asked if you can do $7 a piece. You said yes. Yesterday I paid $7.50 a piece, which I don't care. I paid the extra 50 cents, not a problem.
Why $7.50? You told me it was $6. That's what I want you to charge me $1 extra. Why $7.50? It was $7.50. That was the price I told you maybe $7. I never said $7.50.
Honestly, I was just no longer comfortable. Luckily, the day prior, I was able to buy $27,000 worth of masks, so I jumped back in the van and headed to one of the testing sites where my first batch was already in use.
Hi everybody, I'm here today to walk you through what it's like to come to a drive-through testing site to be tested for COVID-19. I know a lot of people are very anxious, and I know this is a very scary time, but these are great sites to help people get tested safely, quickly, and securely. And so we want to alleviate any sort of anxiety about this, and we're gonna walk you through and drive you through actually what it's like for a real patient. Patients come in if they already have an appointment and they've already had the order, so they've been screened to make sure that they meet the criteria that are set out by the CDC and the Department of Health to get the test. We're gonna have Dr. Mike keep his windows up at all times. Dr. Mike, with your windows up, are you scheduled to have an appointment today? I'm gonna make sure that Dr. Mike is on our schedule. Yes, you are. Let's wave you through. At this time, the patient will be held here until they make sure that the nurse in the tent is free to do the swab. And once they do, they're gonna say, Mike, Dr. Mike, continue to keep your window up until you get to the nurse at the end of the tent. Drive straight through until the end of the tent. The nurse will tell you when it's time to roll down your window. And at this point, the patient will stop. The nurse will put on her appropriate personal protective equipment and give the instructions to the patient to roll down the window to have the swab done.
Any recommendations for patients at home who are maybe having mild symptoms? Do they need to get tested? Do asymptomatic patients get tested? Do we have any guidelines on that?
So unfortunately, right now, given some of our constraints like we just talked about, patients who are healthy, so they're not elderly, they don't have any underlying medical conditions, and they feel well, they can care for themselves, and they can eat and drink, they're really not being recommended to be tested at this time. For patients who do meet the criteria, so anything above that, of course, we recommend that they get tested. And if they're critically ill, of course, that they go try and get emergency services.
As I just did a little mock patient example here, if I was to get the test done, how long would I expect to wait for the results?
So at our testing facility, the lab we're using takes about 3 to 4 days for the results to come back. They are variable. There are some tests which I know come back within a few hours, some that take 24 to 48, and some that take 3 to 4, and some that take even longer. So I think it ranges a spectrum, but a few days.
All right, this is why we did this entire journey, to get personal protection equipment for those who are on the front lines, individuals who are going to be working a testing site just like this. People need to get tested, but doctors, nurses, all health professionals need to be protected. That's why I went on this journey to get these N95 masks. Sites like this are going to be using them. Hospitals are going to be using them. Medical offices are going to be using them. COVID-19, alert, not anxious. Alert, not anxious doesn't just mean alert with the news reports and the information that's being put out by the CDC, the WHO. It means also being alert to what your body's symptoms are. So if you start getting worsening symptoms, please contact a healthcare provider before going to the office, before going to the ER, so they can guide you on how to not get people sick that are around you. If you have any medical supplies or anything that you think could be used as medical supplies, contact your local hospital, see if they can be of help, because those supplies are truly, truly in demand, and we need them now more than ever. And please stop buying masks for personal use. I put together a couple of playlists for you here and here. Check them out. As always, stay happy and healthy.